Hi, everybody. My name is Dr. Poppy Moon, and I am an assistant professor of counseling at the University of West Alabama. And today I have my good friend, of course, I have my weenie dog Snoots, he's always here, but I have my good friend who is the department head for counseling leadership and special education at Auburn University in Montgomery. And what we've been doing is talking about some myths and some stereotypes that go along with sexual minorities. So I know that when we start out as a new counselor, we're often nervous. We don't want to say the wrong thing. We don't want to do the wrong thing. So today we're just going to talk a little bit about some myths and stereotypes and how we can use that in our counseling practice.
All right, very cool. It's good to be with you guys. While we're talking about this and just some myths and stereotypes, here's some of the things that we may look at briefly today. Myths and stereotypes, what to say. I mean, most of us don't want to be offensive. And how many of you have ever said, I'm not sure how to put this or how to ask this question? And usually when I hear that, I'll go, oh, okay, I'm very fine with that. So if someone is already acknowledging, I may be saying this wrong or offensive, that's cool. Anytime that we want to ask an open question, that's fine. And that also calls on me not to be so hypersensitive that I can't acknowledge that this is coming from just a place of wanting to know. So, what to say, what not to say, and then what to do to be an ally or help to people that are coming to us. Some gay stereotypes. I always like John Inman in the series, Are You Being Served? And he was kind of a bit of a stereotype, but also hysterically funny. And so I do remember when I first came out, I was getting ready to do a presentation, and a friend of mine who had just come to know me sitting in front of the mirror, and she said, could you do something with my hair? And I said, Sugar, I know what you have heard about my people, but you do not want me to try and fix your hair. So let me ask you guys, what are some, think about it, and you may want to put this out to Poppy later on. What are some of the things, whether you think they're accurate or not, that you have heard about gay people or lesbian people, bisexual, transgender individuals, whatever? So what are some of the things that you've heard? So you might want to write them down and have this in a discussion with your instructor later on. Poppy, when you look over this list, do you see anything there that stands out to you?
Okay, the two things that stand out to me is that men are crazy with flamboyant fashion, and that ladies who are lesbian normally wear Doc Martens and overalls and maybe a waffle shirt.
I've heard flannel.
It's not true, but
Yeah, I've heard flannel referred to as a lesbian's negligee. And stuff like that. These are ridiculous stereotypes. And obviously not all gay men or lesbian women cross-dress. I have my good friend Ambrosia Starling, who is a drag queen from South Alabama, once told someone, this is my work uniform. This is what I do for a job. I'm wearing 100 pounds of fabulous in summer. This is not what I do for my jollies. This is work. All gay men speak with a lisp. Well, no.
I've never heard that one before.
Yeah, and of course I've heard the bit about hate sports, roll tide. No, there's nothing that says that they hate sports. Fashion and style experts, well, hell yeah, you don't wrap all this in a brown paper bag or anything like that. No, I was telling someone that was coming to visit the house, I said, there are gay men that Martha Stewart calls for ideas, and I'm not one of them. So now, and then sexperts, I was sitting out at a restaurant with friends, and these two ladies started stirring their coffee, and they said, so is it true what they say? And I just said, stop it. I'm not a sexpert. obviously I'm very good at it, but if you really need to call Dr. Ruth or a sexologist,
Yeah.
I'm just your average Joe. The other thing is all gay men want me. Now, I've actually had friends that say, well, I'm all right with you telling me that you're gay and everything now, but you better just not be making I was like, do you not think I can't do better than you?
Oh.
Just you think that just because you're a dude, I've got to have all that. I can do a whole lot better than you. So, just because someone's gay doesn't mean that they want to jump your bones. Shortly after, it's a sad story, shortly after my husband was killed in a car accident, I went to see my dentist, and my hygienist is a lovely person. And the last time that I came in, she knew I was about to get married.
Mm-hmm.
And so she asked me, well, how is marriage treating you? And I just said, my husband passed.
Mm-hmm.
And she just looked at me so sadly and kind of pulled back a little bit and said, did you know? I said, what do you mean? She said, did you know that he was sick?
Oh, she thought automatically.
Thought that because he was gay, he was HIV positive. Not all gay people are HIV positive. Not all straight people are HIV negative.
Mm-hmm.
But there is a tendency to, and I've had people do this, where that you hear about a gay figure or person that passes away, and they say, "Oh, was it AIDS?" Why are you asking that question? The assumption is that must be what it was, not necessarily.
Mm-hmm.
There are other myths that are out there. Of course, my favorite one comes from the movie Steel Magnolias, where the lady says all gay men have track lighting and all gay men are named Mark, Rick, or Steve. Not necessarily. Now, of course, there's that gay agenda that we've heard about. It's terrifying. They worked at their jobs. They shopped for groceries. They even went to the movies. I have to tell you that when it comes to being a gay man in Alabama, my life is probably about as boring as yours. That I do a lot of just really dull, mundane things. I mow the lawn, things like that. I do laundry. I had a lady one year, I was working in a nursing home in mental health, and this lady said, well, Dr. Paul, I love you, but I just don't agree with those things that you do. I said, what are you talking about? Well, I said, Miss Hawkins, are you up in this nursing home talking about sex? She flushed 5 shades of red.
Well, that's surprising to me that like people seem to think that your sex life is something that they can discuss. Whereas if someone said something to me, they wouldn't be like, oh, Poppy, what's going on with you? It's interesting that people feel like they can cross that boundary.
It's bizarre. I had a family member that in recent history that just said, well, we just don't, we love you, but we just don't understand. Mm-hmm. And I said, well, what don't you understand? I'm willing to answer any respectable question. And she said, well, which one of you is the woman? And I said, well, baby, neither one of us. So we've got this whole homosexual thing absolutely wrong.
Yeah.
And I said, here's the real myth that I want to dispel for you, for any of your students. When you see a straight couple, say an older couple, and they're walking down the street, and maybe they stop and they look in a shop window, and you can look at them and think of their history, and you say, they probably met in high school, mm-hmm. and they had a funny story about the engagement, and then they got married and they had children, and they were members of the community. They were part of the PTA, and their kids played baseball and all of this. So you can see with them a wide array of their life.
Right.
But if you see me with my husband holding hands, all that people see is a sex act. Mm-hmm. They can't get out of their head, here's 2 guys that are probably having sex. Now, they're not going to see how we met and how
Right.
we grew together and the things that we've been doing together. The only thing that they can think about is that.
Mm-hmm.
So why is it with one set of people, you can see them as a whole human being,
Mm-hmm.
and with another set of people, the only thing that you can see is that one thing
Mm-hmm.
that doesn't occupy their whole life.
Mm-hmm.
It's just a part of it.
Mm-hmm.
So when we look at people, when we look at students, I hope that we're going to be seeing, when you're a school counselor or a clinical mental health counselor, that when you see your students or you see your clients, you will see them as whole people,
Mm-hmm.
and not just something about that part of their life. While we're looking at some of these myths, the myth is no, homosexuals do not molest children at higher rates. The fact of the matter is, I dealt with more heterosexuals that were molesting children when I was in community mental health. That same-sex parenting or parents harm children. No, they don't. The American Academy of Pediatrics will tell you quickly that children of same-sex parents do as well or better in some cases than that of straight parents. I and my husband are expecting our first child. And let me just tell you, we're doing something that you will never see in a straight couple. You will never see two men who had a child by accident. There are plenty of straight couples out there. They didn't intend to have children, or didn't intend to have children right now. Now, they may have accommodated themselves to it and all like that, but you're never going to see gay people that had kids by accident. And there's a lot of kids that are in less than good parenting situations because their parents really didn't want to have kids or didn't want to have them at that point in their life. So just something to think about. It's ridiculous to think that a person becomes gay because they were abused by someone who was gay. That's ridiculous. It's just really ridiculous as suggesting that if you're straight, you must have been abused by someone of the opposite sex. That's not what forms sexuality. It's not learned. You at no point learned or chose to be, and here's good proof of that it's not a choice. Anybody that would choose to be gay in Alabama is out of their mind. No one chose to be one of the last minorities that it's okay to discriminate against. The notion of length of life is false, that people who are gay and that are taking care of themselves live as long or longer than straight people. Some of the weirdest ones I've heard are that homosexuals controlled the Nazi Party. Well, if you were paying attention to the short history of the rainbow, that's patently absurd. All of these things are just are ridiculous. Now, if we're trying to wrap our head around the concept, if it's a question of understanding, we've got several different things and constructs that we have to kind of get in our head. That sexual orientation is not about who you have sex with, because you can have sex with all sorts of things. We'd like to talk about the people in prison thing and the sex of opportunity and that sort of stuff from time to time. But orientation is who you are attracted to. It's who you see across the room. It is what gets your heart racing without having touched anybody. That's a cute kitty. I've got one like it.
Sorry.
So orientation is affection. It's who you are affectionately drawn to. Now, biological sex may not coincide with that. Sexual expression is how I present myself. Some of you will remember from the 80s, Boy George, that performed the song Karma Chameleon, or the other song, Do You Really Want to Hurt Me? And his expression, the way he dressed, he wore eye makeup and he dressed kind of halfway male, female. It's very androgynous. So expression can be from feminine to masculine to androgynous in the middle, how a person represents themselves, presents themselves. And then sexual identity is actually in your head. It's not the plumbing, it's the wiring.
Mhm.
It is how a person, when they see themselves in the mirror, how they understand themselves. So when we talk about transgender individuals, then we're talking about people who, when they think of themselves, they think of themselves as perhaps a gender other than that, as
Mhm.
how they were biologically identified.
Mhm.
And then when we talk about biological sex, we have male and female and intersexed.
Mhm.
We used to say hermaphrodite. We don't use that word anymore. It's offensive, but it means someone who is born with sexual characteristics of both.
Mhm.
I will say in some states, the doctor gets to make that determination.
Right. I was going to say, I've read about that before, that they would do it immediately so the parents didn't have to be embarrassed.
It's
And
a
they
bad idea.
yeah.
I have a associate in North Alabama that was identified by the physician as male
Mhm.
when she was born, and then in middle school started to develop breasts
Mhm.
because her body had another idea,
Mhm.
and has since had to had reversed surgery to correct that,
Mhm.
because was already identifying mentally as female.
Uh-huh.
And so they usually are these days, they're saying let it go for a while
Mhm.
and let the child
Decide.
manifest how they identify themselves.
Mhm.
It's going to be evident
Mhm.
soon enough, and then make that determination rather than making it right away. You may
Mhm.
make a mistake.
Well, how can you have a gender reveal party?
How about we don't have a gender reveal party? How about we're having a baby, and
It'll be fine. We're just having a baby, not to
we're
worry.
welcoming a child into our family. So this, this, and really what you're referring to there is the families, the parents' sense of the child that they hope to have as opposed to the child that they have.
Mhm.
And so putting to rest and helping parents put to rest, this is what I was hoping for. Even if your child comes out as gay or lesbian or bisexual, it's that thing of, okay, but here was the plan that I had for my child, not the
Yeah.
plan that they had for themselves.
Like my mother always said that she wished I was a little girl that would play with paper dolls with her. And as you can see, that would, anyone that knows me would know that that is like the furthest thing that I would possibly sit and do. So she always is like, oh,
You are probably the one blowing them up with cherry bombs.
yes, 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 exactly. So sometimes I feel sad for her. I'm like, oh, I wish I could have been that little girl. But I think when you become a parent, you have to get what you get. It's not like you can choose exactly what you want.
Oh, sure. Well, and of course, and this is for your students, this is kind of a brief overview, but of course, in terms of what to say, how do you wrap your language around this? You don't want to offend people. Um, my personal thing is that when my husband and I became engaged, he had family all over rural North Alabama that were contacting him to say, well, that we love you no matter what. Now, that's what you always want to hear when you announce that you're getting married. You could be a murderer or a thief or any number of horrible things, and we would love you no matter what. That people that say that think that they're being real accepting, but what they're meaning is there's a what.
Uh-huh.
So we'll love you no matter what. Thank you so much.
Yeah.
Appreciate that. Um, so not it doesn't help to hear I love you despite who you are.
Mhm.
So what to tolerate? So homophobic comments and jokes are harmful if you they really are. So we'll look up the video by Wanda Sykes sometime. She hears a kid saying, well, that's so gay. And she steps in to correct that. So let people know that's not all right.
Mhm.
You never know who around them is being hurt, but when they say stuff like that, and we even here in the South, or the Southern Poverty Law Center has a great curriculum called Teaching Tolerance.
Mm-hmm.
My only problem with that expression is it says that I have the right to tolerate you.
Mm-hmm.
I don't have to accept you.
Mm-hmm.
I'm going to tolerate you, and I have the power to just be tolerant.
Mm-hmm.
Let's talk about accepting people the way they are.
And that's what I want my students to understand, is that you don't tolerate someone. As counselors, we need to feel empathy for people. And when you feel empathy, it's not just like, oh, that's okay what you are, is you try to take on the feeling, like, what's it like to feel that way? And how can I respond to you in a loving way that, they always say walking in your shoes. I think as counselors, we need to try to understand. And I don't know that we always do a great job of that.
Yeah, absolutely. But yeah, we need to do a better job of letting the student know that they are accepted for who they are and not who I think that they should be. But in terms of terms, there's a whole lot that I can get into. You may want to look briefly over this list and see if some of these don't make any sense to you. I'll just mention a couple of them. You talk about drag. Does anybody know what that is? Well, it's from an expression from Shakespeare, dressed resembling a girl. So if you see a drag queen, this hopefully, of course, I remarked to somebody one time, in Alabama, we don't have drag queens. We just have sad men in dresses. But sometimes what you have is someone not doing it very well. A drag queen should be someone that has shown themselves to do it well. Now, there are drag kings as well. If you see someone that is a drag queen out of drag, then they would say in the old days, they are dressed on drab, dressed resembling a boy. Now, we talk with gay and lesbian and transgender and bisexual people. You have family of origin, but you also have family of choice. And very often, for example, 50% of all homeless youth in the United States are LGBTQ.
Mm-hmm.
A lot of them were put out of their homes because they were gay. And so they have developed a family of choice around themselves because they have been put away. Same thing with older LGBTQ people. They may have developed a family of choice because their own family don't accept them. Down in the lower right-hand corner, you see the one of the older acronyms, oddly, because they've added to this. SAMHSA is the Substance Abuse and Mental Health Services Administration of the United States Department of Health and Human Services. And they came up recently with this. So you see in purple down here, I've just corrected it. That's the acronym that's recognized by SAMHSA, LGBTQIA2S. Any one of you will pause here for a second and see, can any of you tell me what that stands for? Poppy, you want to give it a try?
I don't want to. I can get the beginning part, but I don't think I can continue on to the end. Lesbian, gay, bisexual, transgender. You're going to have to take it from there.
Okay. Queer, questioning, intersexed, asexual, ally, and for Native Americans, two-spirited. I don't like the alphabet soup because I think that it starts to get a little bit ridiculous after a while. But I will say I was at a conference and one of my students had that acronym on their poster. And someone came up to the poster session and looked at it and got excited and ran off, and she was afraid she might have had something that offended them. He came back with his friends and pointed to that and said, and he was Native American, said 2S. That's the first time at this national conference on LGBT issues that I've seen my people represented there. So sometimes it's a little annoying, but if it makes a kid feel that they have a place at the table, then it can be worthwhile. Queer is the term that has been taken, particularly by younger members of the community, to be all encompassing. We used to use gay as meaning, we're not saying just male, that just was the broad term.
Mm-hmm.
But because there was some concern that that may have been too narrowly identified with males, okay, they kind of took in what was used as an insult, and queer just means different, to say this encompasses us all. Questioning, just someone that's still trying to understand their sexuality. Intersex, as we've talked about before, having features of both genders. Asexual, someone who does not identify themselves as sexually attracted to either gender, or does not identify themselves with either gender, someone who is non-binary.
Mm-hmm.
An ally, someone who identifies with the community and stands beside us, who is not necessarily LGBTQ plus themselves.
So could you answer a little bit on non-binary? When we were in supervision the other night, a student had stated that she has it's a male student at school, but he's non-binary, would like to people refer to himself as themselves or they. And I think a lot of people have a hard time understanding what to do in that situation.
Well, and this can be a very different thing. Of course, I would tell people, and I'm shifting back a little bit. Can you see the genderbread man again?
Yeah.
Okay. You need to think of it in terms of most of us will have a sexual identity hardwired that in which we think of ourselves as male or female. Some people, however, do not clearly identify themselves internally as either one or the other. They may, and usually you will often find a lot of people will dress more androgynously in those cases, but not always. And so this is someone that their mental wiring, if you will, they do not see themselves as either gender, maybe a combination of the both. And when we talk about pronouns, then here we have at the bottom row, you have what are some of the non-binary pronouns that they prefer to use. She instead of she or he, je or and I can't ever pronounce that one right, but je or jers, objective or possessive, and yourself. It's kind of with that Z sound. I've really only known one person that was very definitely defining themselves in terms of non-binary, but this is just and two, I'll say it never hurts to say, and a lot of times you'll see on my emails the footer says my pronouns, he, him, his, so that if somebody sees that, then not only do they know how I refer to myself, but they know that they can let me know. I will say it's better to ask someone, what are your pronouns, than to say, what are your preferred pronouns? Mm-hmm. Preferred sounds like I'm suggesting that sexual orientation is a preference. Mm-hmm. Now, it's usually, if it's respectful, most people will be okay. But I just like to say, what are your pronouns? And think of it in terms of, if you ask someone, what is your, and people I've heard say, what is your authentic pronoun? Mm-hmm. Or what is your authentic gender? Or something like that. Mm-hmm. Put it in terms like this. Some of you know about Bruce Jenner, who transitioned to female. And so Caitlin is her name. Mm-hmm. So if Caitlin, here's a brain twister for you. If Caitlin, I don't know what her preference, her orientation is, but if Caitlin says that she is attracted to women, mm-hmm. is Caitlin gay or lesbian? If Caitlin's authentic gender and how she identifies herself is authentically female, and she's simply had gender corrective surgery to correct that, then is she lesbian or is she gay or is she straight?
I would say if she identifies as a female, the majority of females date males, it seems like that would be, but you wouldn't, I mean, you wouldn't know for sure, I guess, unless you ask.
Yeah, if Caitlin says I'm attracted to females, then Caitlin is lesbian.
Uh-huh.
It's for those of us that are cisgendered, CIS gender, for cisgendered individuals, and what that means is, in terms of my gender and my identity, I identify myself synchronous with my biological gender.
Okay.
So I am biologically male, and I understand myself to be male. I am biologically female, and I understand myself to be female. That is cisgender. Now, a cisgendered person obviously still may be attracted to a person of the same sex. Now, when we talk about that, that kind of brings up another thing: how to avoiding offensive language. Really, homosexual, if it's out of a clinical setting, is regarded as offensive. You don't say, well, that's a heterosexual man. And notice in the South, the way we'll do that is, Paul is a lovely person, but he's homosexual. We'll lower our voices and we'll whisper. So you don't typically refer to someone by what they do in the bedroom.
Mm-hmm.
So gay is preferred, or gay man or lesbian is preferred to saying someone's homosexual in that casual sense. Unless you're using clinical to describe clinical stuff, you typically don't
Right.
use homosexual. You don't say homosexual relations. They're in a relationship or they're married. You don't say they're gay married. No, they're just married. By the way, I'll throw this out there. This is my personal thing. People will say partner.
Mm-hmm.
No, Jonathan is not my partner. He is my husband.
Mm-hmm.
Because when I introduce him as my partner, people will say, what line of business are y'all in?
Uh-huh.
No, and it sounds sterile. He's my husband. Find out from a couple that they prefer wife, husband, or spouse, or whatever, but typically people are going to say husband or wife. Sexual preference. This morning I combed my hair this way. Tomorrow I may comb it straight back. That's a preference. And I can change it when I want to. Orientation is not so simple.
Mm-hmm.
If you want to say not homosexual or gay agenda, how about just civil rights or human rights?
Yeah.
There's all sorts of terms out there that we know are offensive.
Mm-hmm.
And so we want to avoid those. I actually had someone tell my husband, and he wanted to introduce him to someone in his church that was a pedophile because he figured that they would have things in common.
Mm-hmm.
How my husband got away with hearing that without punching them, I don't know. So no, I don't think I really have that much in common with someone that was abusing children. Thank you, though. I appreciate that offer. So we want to avoid those things like that. Don't make assumptions.
Okay.
How to be an ally. I like that. I'm straight, but I'm not narrow. Don't participate in bullying is kind of one of the stage things, or simply denying it. Oh, I'm sure that they didn't really mean that. Mm-hmm. I'm sure that they were. No, don't ignore it.
Okay.
Don't deny it. Don't participate. And then the next step of being an ally is you recognize what's going on, but you're not taking any action. Recognizing and interrupting it might be as simple as, excuse me, but what you're saying is offensive. So please don't say that. Please don't do that. Educating when you have an opportunity. And
counselors need to be willing to step in and do these things.
Yeah,
because
absolutely.
That's what you want to be, the person at the school that is accepting and is prepared to stand up for things that aren't right.
Yeah. I remember so vividly from my own high school, hearing students carrying on in a classroom in front of a teacher and nothing was said. And I'm looking at the teacher going, and it wasn't even directed at me. I was the one that was having to speak up in my high school class. And in those days, that was not easy to say, that's wrong. Y'all need to tamper it down. This teacher never said, there was this bullying and nothing was ever said.
Yeah.
You and I were talking about earlier about some incidents that I was aware of things that had happened. I had a student that approached a school counselor in their school and said, Ms. So-and-so, I need to talk to you. I believe that I might be gay and I just need to talk to somebody. And this school counselor looked at this young fella and said, I can't even talk with you about that. So the person that is paid to listen, the person whose job it is to be my advocate, is not even allowing me to talk about what's concerning me. Worst case, there's not the worst case. Another case that I heard about was in North Alabama, and the mother called me to say what could be done. I'm a past president of the Alabama Counseling Association, and she said, what do I need to do? And I said, what happened? She said, my daughter came out as lesbian in her school, and the school counselor took it upon herself to abduct her 3 friends off the hall, pull her into her office at different times. They were separate incidents, and let them know that my daughter would answer to God for what she was doing, and that they needed to consider who they were friends with, because when you lie down with dogs, you come up with fleas. Those are the words the school counselor used of one of her students. All 3 students confirmed that this is precisely what was said to them at different times. And she went to the school principal to try and address this matter, and nothing was done. She went to the superintendent of schools and nothing was done. And she said, what can I do? I mean, this is someone who should be advocating for the student. Now, I will, for those that are listening to me that might agree with what this school counselor did, let me put it to you like this. I'm sure that there are underage drinking going on in that high school. I'm quite frankly sure that there's probably teenage sex going on in that high school. I'm probably sure that there's all sorts of things that school counselor might disagree with on the basis of her personal religious views.
Right.
But none of those other students were being pulled off the hall. None of those other things were being addressed.
Right.
This is an opportunity for the school counselor to show acceptance and support for somebody who's going through a rough time. High incidence of suicide amongst LGBTQ youth that are in unaccepting circumstances. High incidence. Now, somebody out there is probably thinking, oh, well, being gay makes people kill themselves. No, it doesn't. It's very simple. Any child in an unaccepting situation where they are not supported is at risk. A child who is LGBTQ is at higher risk because of the level of lack of community and family support that they may be getting. So these are just some of the things to consider. What if you were that school counselor and this student did themselves harm later on as a result of
what you said,
your meddling that has nothing to do. We know what the Code of Ethics says. We do not impose our personal values on a student. We do not impose our personal values on a client. That's a perfect example of it.
Right. What if, like, for instance, we're in the Bible Belt, and a lot of people are very, through their church, they have certain attitudes about homosexuality that is ingrained in them since birth, when they start going to Sunday school. How can counselors step out of that and leave those thoughts behind and be accepting of things they don't understand or things that they are uncomfortable with, what would you tell a counselor to do?
Okay.
It's
So a couple of things to think about there. So the old hickory nut of wisdom that's been shared for some time is that idea of, if I am not comfortable with the client, I should refer the client.
right.
And I'm sorry, but I'm going to have to dispute that strongly, because it's not about my level of comfort.
Mm-hmm.
I don't need to kidnap the client's needs to serve my own needs.
Mm-hmm.
So think about it like this. I'm not comfortable with people that don't bathe regularly and might come into my office. A lot of my clients didn't. I was working in rural mental health.
Mm-hmm.
Think about it like this too. If I'm uncomfortable, is it because I don't think that I have the skill set?
Mm-hmm.
Is it competence? Now, when it comes to competence, how about if I were to say, I'm just using this as an example, I'm uncomfortable. I don't believe I'm competent to work with Asian Americans.
Mm-hmm.
The Code of Ethics tells me that having an understanding of diversity and working with diverse clients
Mm-hmm.
is not an excuse. I can't use competence because I am supposed to, by virtue of who I am as a therapist, as a counselor, as a school counselor, have a level of ability to work with multicultural clients. If I said I'm uncomfortable with Asian Americans and I start referring all of those Asian Americans out away from my office, maybe one, until I can get a better handle.
Mm-hmm.
But if I start referring every Asian American out of my office, what does that tell you?
Mm-hmm.
That's not strictly a bias or a lack of comfort. That has become discrimination.
Mm-hmm.
So if I routinely refer people out of my office because I'm uncomfortable with them, then that is what we're talking about bias. The Code of Ethics tells us that when we become aware of a bias, that we have a responsibility to become more aware of our biases, to gain more knowledge about working with wide groups of people and more skills in working with wide groups of people.
So part of the counseling journey is to always strive,
Right.
more accepting, and that's something that we're taking on when we choose to be a counselor, is to become a person who is willing to grow.
Yes, I mean that is the commitment of being a counselor. It's not to convert people to my religious views. We already know that that's not what we're there for.
Right.
It's not to change people who are not coming in. I had a friend here in Montgomery that went to see a therapist, and he contacted me and said, "Could I make a recommendation?" I said, "I thought you were seeing someone." He said, "First session I went in, I told the therapist that I believed that my depression was affecting not just myself, but my relationship to my husband." The therapist, upon hearing this, literally took a gasp and sat back away from the client. And he looked at her and said, "But okay, understand, I'm not coming because I'm gay. I'm fine with that. I'm coming because I'm suffering from major depression." And the therapist said, "Well, you realize there's a consequence for your behavior."
Oh, okay.
And just would not let go of you. Your problem is that you're gay.
Mm-hmm.
And so people aren't coming to us because they're typically distressed with being gay or lesbian.
Mm-hmm.
They're coming to us for help.
Mm-hmm.
And that's what we're there to provide.
Mm-hmm.
Kind of got off there. Help me, what else are we talking about?
Well, just one other that I remember you were talking about, that a student had gone to the counselor to talk to them about things, and they just looked at them and said, "I can't talk to you about that."
Right.
And just
Now,
walked away.
something that here's where we might find ourselves in conflict with more than just our own selves. I did have a counselor that told the student, "I can't even talk with you about that."
Mm-hmm.
And so here's the thing. What is the policy of your school district? We know what your code of ethics says, that if a student comes to us, that they're there for support. They're there for resources. They're there for what we can do to help them navigate their own way through what they're dealing with. Alabama's K through 12 sex education code currently says that the subject of homosexuality may not be brought up, and if cannot be broached by the teacher, but if it is brought up in the classroom, then the teacher is simply to respond to let the students know, first, that it's against the law, and secondly, that it's socially disapproved of.
Mm-hmm.
Now, when the Supreme Court decided to strike down the sodomy laws years ago in Lawrence versus Texas,
Mm-hmm.
That said what two people by on their own consent do in the bedroom is none of the state's business. Being gay is not against the law.
Mm-hmm.
Alabama's sodomy laws finally were done away with a few years ago. And it's only been within recent years. So it's not against the law.
Mm-hmm.
It's socially disapproved of. That's a value judgment. Who disapproves?
Mm-hmm.
So our current K through 12 code in this State Department of Education is out of step with reality
Mm-hmm.
and with the law. Some school districts, frankly, just don't even pay any attention to it. I know of one school district that is so rigid that they say if a student has issues with being gay or lesbian, they're supposed to come to the office, sign a form, check the box that says that they want to talk to the counselor about that, and hand it to the secretary.
Now, does any student have to do that to go to the counselor, or just?
No, specifically if it has to do with LGBTQ.
Okay.
And so basically what they have done is create a paper shield. No one's going to do that.
Right.
They would be exposing themselves, outing themselves in the school office. It's just absurd.
Okay.
And so they're able to say that we don't have any students like that
Yeah.
in our school district.
Well, Paul, you have talked about a lot of stuff that I think is very interesting, and I hope that this is something that is going to help my students as they work on becoming counselors. I hope that you and I will talk again and discuss some other issues, but I want to thank you for today, and I hope you have a good rest of the afternoon.
You too. Thanks for having me.
No, I'm happy to.